Good afternoon and welcome everyone to this AGM and annual members meeting. My name is Dean Fathers, and as Chair of Nottinghamshire Healthcare I'd like to formally welcome everyone here today. And before I carry on with the rest of the speech, I'd just like to do something special to myself. I hope I said it okay.
Not bad.
Not bad. So, one, out. So, few points of housekeeping before we start. Today is an opportunity to review what happened in the last financial year and explain to you what our year-end position was. We'll also review some of the highlights in what has been another busy and exciting year, although not without its own challenges. Our ambition is to provide the highest standard of patient and service user care, and this remains core to our strategy. But before we go on to explore those results, first of all, some business matters. Our first item is to approve the minutes of the last annual general meeting / annual members meeting. So can I ask, do we have a proposer? Paddy, thank you very much. And a seconder? Peter, thank you very much. So we've had those proposed and seconded. Are we happy to accept them? Those have been accepted. So the first item is now concluded. I remain proud to be the chair of a membership-based organisation, the membership being represented through the Trust's Council of Governors. The constitution of the Trust details arrangements of the Trust, including those of membership, the Board of Directors and the Council of Governors. I'd like to now take the opportunity to introduce you to the Board of Directors. If I could ask you all to stand, that would be good, those members who are here. So those are the boards, and if you sit down, I'd like the Council of Governors, if you'd be so kind to stand to show who you are. So well represented in both cases here today. Thank you very much. If you do wish to speak to any of those after the meeting, then please feel free to do so. The Council of Governors has two prime responsibilities. Firstly, to represent the interests of the membership and the wider public. Secondly, to hold the Board of Directors to account, specifically through the non-executive directors. The Constitution defines that the Council's composition is made up of elected, public, elected staff and appointed partner stakeholder representatives. During the year, we have been working hard to implement our 5-year strategy and to deliver our vision through partnership, improved lives and quality of care. The Board of Directors lead the Trust, and during the year we have seen some changes. Stephen Jackson joined us as a non-executive director. Tony Morris and Jane Warner both resigned from their non-executive posts. And we'd like to thank them both for all their hard work, commitment and dedication to the Trust while they were with us. We'd also like to thank Chris Clark for acting up temporarily as Interim Executive Director for Forensic Services after Julie Hall, now Atfield, and congratulations Julie on your recent marriage, was successful in being appointed as Director of Nursing following Dean Howell's move to another organisation. During the year, Simon Smith, Executive Director for Local Services, also retired, and this gave us the opportunity to merge two divisions into one, combining physical and mental health into local partnerships, led by Paul Smeaton. Peter Wright was also appointed to the role of Executive Director of Forensic Services during the year and has brought a wealth of experience with him. Colin Draycott, Trust Board Secretary, who many of you will know well, was absent for a long time due to illness and formally retired in April this year. And again, we wish him well for a long and happy retirement. We have appointed Craig Sharple to his position, and Craig joins us at the end of the month. So thank you to all our past board members and welcome to all our new board members. A programme of board development sessions were held during the year, focusing on a range of issues including strategy development, board self-assessment, committee functioning, involvement and engagement, and maintaining high professional standards. 2 joint sessions have also been held with the Council of Governors. These sessions focused on the Trust's ambitions and our approach to sign up to safety. In the current financial year, the board will have to take part in an independent assessment process to make sure that we remain fit to lead the Trust and that we have robust governance processes in place and can therefore provide appropriate assurance. Further details around the Constitution, Board of Directors and Council of Governors changes can be found within the information provided to you on your tables. I will now ask Jenny Britton, Lead Governor, to talk about the Council of Governors and the membership strategy. And before she joins me, I'd just like to thank Suzanne Folkes, who during the year held the position of interim lead governor and has subsequently gone on to retire herself. And again, may I wish her every happiness for a long and healthy retirement. So Jenny, can I ask you to join me at the lectern?
2016-17 has been a busy year for the Council of Governors. We saw a number of valued members leave at the beginning of the year, but have welcomed 15 new governors who are enthusiastic and I hope enjoying the role. I'd also like to welcome John Collins, who's been elected Deputy Lead Governor following the retirement of Suzanne Folkes from the Trust. The other major change for us has been the stepping down of working groups and replacing them with monthly assurance meetings. This has been largely successful, and the Council has been able to learn from senior members of the Trust, external professionals, and at the same time hold the non-executive directors to account on a number of issues. Since the last annual general meeting, the Council have held 4 formal Council meetings where we've conducted a range of formal business. The implementation of the monthly assurance meetings commenced in September last year, and since then there have been 7 meetings which are focused on involvement and feedback, child-adolescent mental health services, sustainability and transformation plans, the 2-year business plan, the people strategy and the workforce race equality standard, the annual quality account and quality priorities, the Care Quality Commission and medium secure services. Every year we conduct an annual review to test the effectiveness of the Council. The conclusion of this year's report demonstrated that the vast majority of governors felt confident in carrying out their role and holding the chair and non-executive directors to account for the performance of the Trust. The report also identified that the Council would like to improve the representation of the membership and would be exploring how this can be done effectively and efficiently. Due to the standing down of the working groups, the Council of Governors reformed the Nominations and Remuneration Committee. The committee now represents different parts of the council rather than being made up of the chairs of the working groups. We've had a recent meeting when we received the outcome of the chair and non-executive directors' appraisals. Subject to the satisfactory appraisals, the Nomination and Remuneration Committee recommended to the council a 1% rise on the base rate of pay for the chair and non-executive directors. This is in line with what the rest of the NHS have received, and the council ratified this. In July 2016, the council approved the appointment of Stephen Jackson as non-executive director, who settled in and engages well with the council. We will be shortly appointing another non-executive director as part of our duties after the departure of Professor Patrick Callaghan. In April 2016, the council approved the appointment of PricewaterhouseCoopers as the Trust's external auditors. A number of governors were part of the working group, which was joined by senior members of the finance team and audit committee to ensure a proper tendering process was carried out. The council were assured by the robust process and feel that value for money was achieved. We've also received the membership strategy and the forward business plan, as well as the Trust's accounts. A number of us have taken part in governor networking events outside Nottingham, which has been beneficial. We've seen how other trusts work with their governors, some of the difficulties they have encountered and how they've been resolved. It's been very instructive and helpful to meet with other governors. We are lucky to have highly competent non-executive directors who've engaged with the council as a second tier of assurance and earning our assurance. As governors, we have regularly attended the board of directors meetings and related committee meetings to seek assurance on the level of challenge and scrutiny carried out by the non-executive directors. In addition to this, we are very privileged to observe non-executives on their site visits across the organisation. This not only gives us the chance to see the non-executive directors engaging with patients and staff, but gives us as governors the opportunity to do this as well and learn more about the services we provide. We recognise that these are increasingly difficult times for the NHS, but we will continue to challenge the non-executive directors, combining site visits with reports from the trust committees and hard evidence to ask the right questions. And finally, you will all have received the membership strategy. This has now been approved by both the council and the board of governors, and I would ask the membership also to support this, if everybody is happy with that. Take that as a yes. Thank you.
It now gives me great pleasure to invite Simon Crowther, who is the Trust's Director of Finance, up to do the next item of business.
Thank you, Dean. Afternoon, everyone. I'm here to talk to you about the Trust's performance for the year, including our finances, which is where we'll start. So, every year, the Trust receives targets from its regulators, from the centre basically, around achieving certain duties and certain financial obligations. This is common across the whole NHS, no different for this Trust. And I am pleased to report that for 16-17 we did meet all our financial obligations after a lot of hard work. You can see from the slide in front of you, we delivered last year a surplus of just over £8 million, which is in line with the target we were given from NHS Improvement. At the end of the year, literally in the last 2 weeks of the year, we also received a further £2 million from NHS Improvement, which is reflected in our annual accounts. So our annual accounts have been externally assessed through the process Jenny's just outlined. We appointed new external auditors. They've externally assessed our accounts and given us an unqualified or a clean opinion. So those accounts are a part of our annual report and they're available on our website should you wish to have a look at them. So just a bit more about where we get our money, where our income comes from as a trust. So this is obviously specific to the last financial year. These are headlines, but they're just to show you the complexity really of how we receive our funding. So the funding comes down from the Department of Health, basically to our commissioners, who then pass it on to us through contracts for us to provide services to our patients and service users. So you can see from what's up on screen, we receive income from many local commissioners, CCGs predominantly in the local patch, but also from NHS England, who are a regional and national commissioner, and they mainly relate to our specialised services. But we also do receive income from local authorities, the county councils as well, basically, for the services we provide on their behalf as well. That just gives you really a broad overview of where the money comes from, which then allows us to say, well, how do we spend it? Where does it go? Again, this is high level, but details are in the accounts, should you want to look in more detail. But the vast majority of the money we get basically goes on our staff, who are there obviously to provide those services. So nearly 75% of the money we receive goes back out in pay, basically. And again, there is a bit more detail on there, but the other significant area of where our money goes, the second highest, is then our buildings, which hopefully more makes sense when you think about how we provide the services through the staff and through the buildings that the public access. Just a few more details. So, as is common across the public sector, all the public sector faces financial challenges. The NHS is no different, and this organisation is no different. So, as part of delivering what I've just outlined in 16-17, we also had to make savings to get there. So, to deliver those targets, we made nearly £15 million worth of efficiency savings last year, which is all around looking how we can be more effective in the way we provide services. But also, just as important to note, we also made some real significant investments, and you can see at the bottom of the slide there's significant investments in the CAMS and perinatal new build, as well as enhancing the buildings at Rampton Hospital as well. So finally on the finances, and this is a bit of a complicated slide, but each year our regulator monitors how effective we are in using those resources. So the resources that come into the organisation, how well do we manage them and how effectively do we discharge them? They give each provider, so again this is consistent across the NHS, they give each provider a rating from 1 to 4, 1 being the strongest performance, 4 being the least. And again, pleased to say that for last financial year we were rated 1 by NHS Improvement. Just away from the finances, this is about general performance of the organisation now, and sustainability is something we take really importantly as an organisation, and you can see from the first bullet point there, we've made some real strides in the year to achieving a national target, a requirement by 2020, but we made some leaps and bounds in the current year around our carbon footprint. And just in terms of the bottom bullet point there, just to be clear, we are developing a new sustainable development management plan, and that will be approved by the board in this financial year, 17-18, as opposed to last financial year. So it's something we're working on now, and something that will be coming through our board of directors in the coming financial year. So moving on to service performance, there's been good performance, but there's also been the challenges. And again, this is just a snapshot of a few of the areas we monitor on a monthly basis throughout the year. We've had good performance in gatekeeping assessments, but seen challenges in the latter quarter of 16-17. But looking at this financial year, we've addressed those challenges, and that's now back on track in quarter one, even though performance did drop in quarter 4 of last year. We've met targets around improving access to psychological therapies, but we do recognise there's more to do around some of the targets for annual staff reviews and sickness and absence rates as well. And then finally from me, just to focus on, again, it's on performance, but it's a bit more specific to clinical issues and again highlighting a couple of challenges we've got, particularly the first one around we've had some data quality issues for clinical supervision, but just to say again, we've reviewed our approach, we've looked at some of the issues we found around it, and we've got a new system, a new plan that's being rolled out in the current financial year in 17-18. And again, I think the bottom bullet point demonstrates some of the challenges we have around harm-free care, but also some of the good performance and actually some of the granularity of the data we've got to be able to take this forward and put plannings in place where we should need to as well. Okay, thank you for that. Again, I'll be around at the end should anybody have any questions or want to talk to me after, but now I'm happy to introduce Ruth Hawkins, our Chief Executive.
Right, good afternoon everybody, and you know what, it's really nice to see so many people who have chosen to spend Friday afternoon coming to an annual general meeting, annual members meeting. It's really good that you are committed to the organisation and want to come this afternoon. So I'm going to do the review of the year of 2016-17, and whilst you listen to me, I would ask you to look at the pictures. Don't look at me, look at the pictures, because they are a fantastic selection of things that have taken place during 2016-17, a celebration of some of our services and some of our fantastic staff. So enjoy the rolling loop as I speak. As I say, look at them, not me. Okay, and that will make me feel better as well. So 2016-17 was year one of the delivery of the Trust's service strategy, and our strategic intent is and continues to be to ensure that patients and service users receive seamless services, that we endeavour to ensure that our Trust's teams work in a more integrated way, and that where appropriate we shift our service provision away from hospital and inpatient care to support people to live independently in their homes. But we recognise that we can only achieve those outcomes if we work in partnership, and we need to work in partnership with our service users, with our patients, with our carers, with our volunteers, with our staff, and with our partner organisations. And simply this is encapsulated in our service vision of through partnerships, improve lives and the quality of care. In the delivery of that vision, we identified 4 key objectives: to provide the best possible care and support, to demonstrate best value, to be the service provider of care, and to make the Trust a great place to work. So for the next sort of 15 minutes or so, I'm going to talk to you a little bit about how we've made progress against those 4 key objectives. I'm also going to talk to you about some of the challenges we faced last year and how we are addressing those challenges, and also about some of the successes and achievements of our services and our staff. Now, Dean's already mentioned the organisational change, but one of the biggest indicators of change to support the delivery of integrated care did come from an organisational perspective, and that's the merger of the 2 service divisions, local services and health partnerships, which came together under one division, local partnerships, under the leadership of Paul. And this came into being in October 2016. We've also seen quite a lot of change in the senior leadership team during 2016-17 as a consequence of people moving on to new opportunities and also retirement. So we've had Julie coming into position as Director of Nursing and relinquishing her role as Forensic Director. We've had the retirement of Simon Smith, and we've had the appointment of Peter from October as the Executive Director for Forensic Services. Within the new local partnerships division, Paul's been very busy putting together in place his senior team, and I'm pleased to see a goodly representation from his senior team here this afternoon in support of today's meeting. The primary aim of the new division is to try and bring and make the integration of physical and mental health a reality across the county, and we're already starting to see some really good examples of that work in practice. So one of the examples I want to give you is in Mid-Nottinghamshire, where mental health and physical healthcare staff are working together in the same team, helping to keep people safely out of hospital. And the Call for Care team provides support to individuals in their own home, which helps ensure speedier discharge from hospital. And that's evaluating really well from our commissioners, but most importantly from our patients. Other services that we've seen change and develop in year are in children and young people universal services, with the delivery of the new integrated care model for children from 0 to 19 years following our tender win. I have to say that the funding envelope that was offered by the local authority as part of that tender process was somewhat less than had been available previously, and this has meant that we have had to change how our services are provided. But having got over some of the initial transition changes, the service evaluation from patients now and from parents is positive about the service offer that's being made. Other new services that have been introduced during 2016-17 are new models of care for podiatry and podiatric surgery. We've seen new service models for the community evening service and the short-term rehabilitation service across the Greater Nottinghamshire part of the county. We've seen the refurbishment of C and D block at Rampton finished, and we've seen the opening of the new physical healthcare suite at Rampton Hospital. In our offender healthcare services, we've seen improvements made across all prisons, focusing on the quality of physical and mental health care, substance misuse, and pharmacy services. Sadly, though, we were not successful in our rebid for the South Yorkshire Offender Health contract, and this was won by Care UK. We're now working with them to ensure the safe transfer of services and to support our staff as the service contract transfers to Care UK from the 1st of September this year. During 2016-17, we also started the building of Hopewood, and that's the name of the new child and adolescent mental health services facility that we're building on Mansfield Road. It will complete the building process in 2018. And during 2016-17, we've had a number of events, but the particular one I want to mention is a particularly magical event when some of the current patients from our CAMS services and their families and from the perinatal services came to the new building site and were able to sign messages of recovery and hope on the steel infrastructure of the building. Another highlight in 2016-17 was the completing of the refurbishment programme at Arnold Lodge, and we now have modern, purpose-built accommodation for men with a mental illness at our medium secure unit in Leicester. I'm now going to talk about some of the challenges that we faced during 2016, and I'm going to cover two services in particular, and I'm going to start with adult mental health services, where we had delays in people accessing crisis services and also pressures on inpatient beds. The access to crisis services was particularly highlighted through patient feedback, through complaints, and then subsequently more formally by Healthwatch. The Trust has taken significant action during 2016-17 and has also done this in partnership with the Crisis Concordat. So we have enhanced the crisis resolution and home treatment service in the city and the south of the county. We're also developing and improving on our liaison psychiatry services, servicing the 2 emergency departments at the Queen's Medical Centre and Sherwood Forest Hospitals Trust to allow the rapid access to mental health professionals for assessment and treatment. And at the start of this year, we also have started the new urgent mental health helpline, and this is for patients who are acutely unwell but not at the point of crisis, and this provides support to GPs who need to seek advice from a psychiatrist. And again, this has been well received by colleagues in primary care. We do understand the distress and frustration caused to service users and carers when they are unable to access appropriate and timely responses for services. And I think we also recognise that it's still not perfect, and we recognise that further development is required, both within the Trust, but also across the wider community, and we need to do this in conjunction with our partners to further improve the services that can be offered within the current resource restraints. We've also seen during 2016-17 considerable pressure on our inpatient beds, which has resulted in some patients having to be placed out of area, that's out of the county of Nottinghamshire. The increased pressure on the acute bed pathway has resulted in the use of private beds, mostly outside Nottinghamshire, to manage those clinical needs. That places extraordinary demands on patients and their families in maintaining the support of patients at what is already a very difficult time for families. And it also places considerable stress and strain on the clinical staff who are managing those patients in those beds outside the county. So to try and address those challenges, during 2016-17, we opened Beacon House in partnership with Turning Point. This is a 12-bedded step-down unit for people who are recovering from the acute phase of their mental illness. We also, during 2016-17, supported the move of Haven House to new accommodation. But we recognise that there's still more that we need to do. So during the start of 2017-18, we've entered into a contract with an independent provider to increase the availability of acute beds actually in Nottinghamshire by 16. And we hope that this will mean that Nottingham patients will be able to be treated in area with effect from this month. The second area of challenge I want to highlight to you this afternoon are some of the issues and concerns that have been expressed about our services provided from Rampton Hospital. In June 2016, the Trust received a warning notice from the CQC relating to the observation policy that was used at Rampton. It was identified by the CQC as not operating effectively. All of the issues identified by the CQC have been promptly addressed, and the CQC formally removed the warning notice in the autumn. In March 2017, so at the end of the 2016-17 financial year, the hospital was subject to a full inspection by the CQC. The findings from their inspection were actually published in this financial year on the 16th of June 2017, and their overall assessment rating was that the service requires improvement. I'd like to assure you that action has been taken and continues to be taken to address those shortcomings and the concerns that were identified in that report. I've talked about a number of the services, about providing best care, about service provider of choice, but the fourth objective of the organisation is making the Trust a great place to work. And it's the Trust workforce, the Trust's employees, who are the greatest asset. Ensuring that we create the right culture for our people to perform to their best has to be the key focus within the Trust. Having the right staff with the right skills, their expertise, their mindset, having them in the right place at the right time is key to everything that we need and want to do. So during 2016-17, we developed in partnership and collaboration the Trust People and Culture Strategy, and this sets out how we will achieve our people priorities around resourcing, retention and recognition, around health, well-being, recovery and resilience, around equality, diversity and inclusion, and around education, learning and development and talent management. The Trust annual survey in 2016-17 was for the first time sent to all Trust employees rather than a sample which had been done historically. And 48% of our Trust workforce responded to the survey, and that's a higher rate than nationally. We are currently using those survey results to support our people and culture work, and over the summer are holding focus groups with staff to understand better what it's like to work at the Trust and what would help improve that. We're also seeing progress on our workforce race equality scheme objectives. I'm pleased to see that bullying and harassment was down in our survey results, and also that recruitment and retention were up. But there's still so much more to do. One of the things that is going to help in that work is the appointment of the Trust Freedom to Speak Up Guardian, Helen Auld, who's going to work alongside our Associate Director of Equality and Diversity, Catherine Conchar. Also during the year, we had a strong focus on staff health and wellbeing. We've improved our counselling service, our stress management courses, and our mindfulness classes have been introduced. We now have 82 health and wellbeing champions which help promote this really important agenda across the Trust. I'd also like to just mention the Trust annual Oscars event, which I know actually a number of you in the room attended alongside the Trust board. And this is where we recognise and celebrate the best of what our staff and volunteers do. As ever, it was a truly wonderful evening, which makes me really proud to be Chief Executive of a Trust which employs such caring and compassionate staff. So I'm going to finish my presentation this afternoon with just a few of the awards and recognition that staff and services received in 2016-17. So the alcohol-related long-term conditions team, they won the Managing Long-Term Conditions Award at the National Nursing Times Awards event. Our integrated discharge team was awarded Care Team of the Year at the East Midlands Care Awards. Our All About Me, which is a new recovery package for deaf people with mental health problems, won the Outstanding Service User Achievement Award at the National Service User Awards. Our Health Shop, which is in Nottingham, received an Innovation and Leadership Award from the Queen's Nursing Institute for delivering an innovative stop smoking project named Cut It. And the Trust's environmental team was the winner in the carbon category at the NHS Sustainability Awards and highly recommended in both the clinical infrastructure and design and energy categories. That's just a few of the national awards and recognition that staff from the Trust gained during 2016-17. But on my service visits across the Trust, I'm privileged to see and hear about the work of many amazing and dedicated staff who provide compassionate, supportive care to patients and service users every day and all day. And I'd like to end by thanking them for their contribution to improving lives and the quality of care. Thank you for listening.
Thank you. I'm supposed to now go to a Q&A session, but before I do that, I'd like to improvise a little bit, and Julie's going to go apoplectic with me as I do this. I'd like to say 3 thank yous, if I may. Ruth really finished off on a very positive point and saying thank you to all those award winners and to all the staff. And I think on behalf of the board, I'd like to just start by echoing Ruth's words. It really is appreciated, the hard work, the dedication, the commitment that the people of this trust have made over this year and continue to make as we speak at this moment in time. It's a sincere thank you to you all. And I'd like to extend that to a particular award that we won, which hasn't been mentioned, in that last year I was privileged to actually meet the Duke of Cambridge on behalf of this trust, because of the support that we give to veterans, reservists, and the families of people who are serving for this country. And that was one of the biggest privileges I've ever had in my life, and I really enjoyed it. So thank you to all of you who supported this trust for winning that gold award. It is fairly unique, and it's not given to many organisations. And then my third thank you is actually to the governors, those that have joined us and those that have served. Just picking up on Jenny's comments, I've just discovered I've been given a 1% pay rise, which was really kind of you to offer. But I'm actually going to make a gesture back. I think in this time of austerity, I'm actually going to suggest that I gift aid my 1% pay rise this year back to the Trust charity. and I'd like it to be used for the benefit of our service users and staff who are hard of hearing and deaf. So that's what I'd like that money to do. So if you could make a note of that in payroll for me, Claire, that would be really appreciated, and we'll start that from this year. So questions. Who's going to be first for a question? Oh, sorry. We'll come to you in a second. While you're walking up to, if you could, I've actually got a question to read, which I must read from the previous kind of request for questions. So we'll start with you in a second while we're doing that. And the first question is actually in two parts. I've only had one written question sent to me before the AGM, and it's actually addressed to the governor. So Jenny, if you would be prepared to answer this, I'd appreciate it. And it actually reads, how do the governors rate the Trust's quality of care this year compared to last year? And what single thing are the governors campaigning for which would further improve quality? So would you like to come and join me?
Thank you, Dean. Well, in answer to the first part of the question, PwC, the external auditors, gave quality a good rating this year, and the number of complaints have gone down, and I thought those were two very good indicators. The ratios for patient safety, clinical effectiveness and patient experience all remain at a high level, although there are some ups and downs on individual, against last year, on individual measures. But we have, as governors, received, or I personally have, received assurance from one of the non-executive directors that the quality remains high and there's a strong desire for continued improvement throughout the Trust. If you want any more further details, please could we meet up afterwards, because it will obviously get into figures. The second part of the question is about the area that the governors will be seeking further assurance about in the coming year. And I think we've decided it will be around staffing. Because although the Trust has some excellent staff, recruitment, retainment and sickness is a problem, not just in this Trust, but nationwide. And although, as Ruth did mention earlier, this is on the management's agenda, I think it will certainly also be on the Council of Governors agenda later. So I hope that answers your question.
Thank you, Jenny. So, Joe, would you like to give us the first question from the floor?
Yeah, the question is, in light of the recent worldwide cyber attacks that have affected NHS IT system and actually disrupted operations as well, has the board carried out an assessment on actual vulnerability of the trust systems, and also these issues of some trusts have been using unsupported sort of IT, and also some of the current projects will become out of date in the next few years. I'd like to ask the board to take this issue quite seriously.
Okay, thank you for that. So, Simon, do you want to come up and answer that question?
Thank you for that. Obviously, it's a it's a really current question, actually. There's lots we're doing. So if I can answer your question in two parts. So in terms of does the board take this seriously? Absolutely. So there were lots we were doing before the attack hit the NHS on May the 12th. We saw that this is a risk, as every NHS organisation does and is doing. And there were already testing we were carrying out on our systems, which had identified that there were things that were good and there were things we needed to improve on. One of the things we've done after the recent attack is said, well, okay, what went well? where we were well covered, and actually what could we have done better in terms of our IT security and in terms of our organisational response as well. So one of the things the board's absolutely taking seriously, as well as across the organisation, is how do we learn from this and how do we guard from it happening again. So this, absolutely the board takes it seriously. This is on our risk register. So in terms of the place where we look as a board and say, what are the real risks that we need to deal with and cope with, this is rated really high, and it's something we discuss really regularly. Just in terms of how it affected us, if I can as well, which might give you some assurance. So as an organisation, we didn't actually have one instance where we were infected. Now, there were lots of our buildings and services that were disrupted where we share those buildings, be it with GP practices, be it health centres or other health providers. Everybody looked to say, has it affected us and how do we recover from it? So it did have an impact. We went into a business continuity process, which is about actually, if we haven't got all our IT systems, how do we keep services going? So again, there was minimal disruption to our services, and everything we did do was reported back up. So on the whole, we were largely protected. That doesn't mean say we didn't have areas of weaknesses. We did. We're working on how we make those safer and how we make those better looking forward. But absolutely, this is a board priority, and something our audit committee, which is where we really consider those risks of the organisation, is see as a key objective for this year as well.
And can I take again the opportunity while I'm in the mood for thanking people to thank all those people who took control of Gold Command during that situation. I saw several of you in our control room frequently, and also to all of our IT department for the way that they actually professionally dealt with the disruption, as well as all those members of staff who had to deal with the disruptive consequences. So another question, if we can. We can't go home now, do we? We must have another question. Okay, Sheena, the speaker beside you.
Oh, thank you. I don't like these silences in these meetings, and I think that carer and service user voices should be heard. And what I'm aware of, I'm one of these sad people who've read the 5-year forward view from front cover to back cover. And the words that stand out for me are experts by experience, empowerment, navigating services, co-production, peer support. I haven't got any sense at all that that's happening here, which is what I feel is quite sad, because nobody said thank you to service users or carers for the work that they've done. There hasn't been any sort of celebrating their achievements in the year, and I'd really like to see that happen. I'd also like to, and I wasn't aware that we were going to focus on staff next year as a governors group, and we have got the power to actually get a group of people together to look at what service users and carers do in the trust, and that is the power of the governors. And I'm suggesting that that is one of our working groups that should happen, so that we can actually see what change is happening in terms of linking the empowerment of service users and carers to the 5-year forward view. And the question is, what are you going to do about it?
Okay, I'll invite an executive to say a comment in a few moments, but firstly, Sheena, you are a council governor, and you were in the meeting where the governors made that decision. So it's kind of the governors made the decision as to what the priority was. So it shouldn't be news to you. In terms of other forums, we do celebrate carers and volunteers. So I go to the Nottingham Post Volunteers Award, and we have a whole conference for volunteers and for carers to celebrate, and that's say thank you to them specifically. So we do as a trust, I believe, take those very seriously. But Ruth, who would you like to speak on the answer to that?
It's me. I'm going to respond to the first part of Sheena's challenge. The issue about the governors sits with the Council of Governors. In terms of the involvement of service users, celebrating the work of carers, about how we empower people, how we involve people in developing new service pathways. There's always more that we can do, and I would be the first to admit that. But to infer that there's nothing that we do would be wrong. So it's about getting that balance right. So, for example, I did mention the Oscars, which was a fabulous event, and at the Oscars, a number of the actual awards and celebration were for volunteers who are supportive of our services, and I can see worthy recipients or sort of finalists of that particular award in the room this afternoon. I was at an event celebrating the year of involvement at Rosewood. When was it? 6 weeks ago? About that. That was a fantastic celebratory event of the sort of the work of people who are involved and actually provide support to service users across our services in the north of the county, and particularly in terms of the work that they're now doing innovatively in the forensic services in terms of supporting services. There's always more we can do. Absolutely, there's always more we can do. We recognise we've made some quite strong improvement in terms of our peer support work, for example, under the leadership of Liz Wilker. We've got over 100, I think, peer support workers now employed by the organisation. But again, there's more that we can do, and there's more that we will continue to do. In terms of our carers strategy, I think we're in year 2 of our implementation, although this is actually probably year 3 now that we're into the implementation of our carer strategy. Again, there's more that we can do, and there's more that we will do in terms of building on things. So it's about actually getting that balance right about actually what we will do and what we can do and what we aim to do. But to infer that we've not done anything, I think would be unjust. But I think we just need to recognise that, as ever, there's more that we can and want to do in terms of improving that. Because at the end of the day, that's why we're all here. It's about actually providing the best possible care for patients and service users.
Okay, any other questions, please? Another question? I can't see any hands. Okay, it looks like we have no more questions. In which case, I'd like to take the opportunity of thanking you all very much for coming. Please feel free to stay and mingle and talk and network with your colleagues, peers and friends for a little while. Those of us who are going to be from the board will be staying around for a little while as well. If you want to talk to any of us, please feel free to do so. If you want to ask us any questions on an individual basis, please feel free to do so. Can I thank the members of the deaf community for coming along, and it was nice to see you, and we look forward. Thank you. Thank you. And can I wish you all, those who are leaving now, a safe journey home, and for those who are staying, please help yourself to a cup of tea. I think we've got refreshments at the back. Please stay for a while and enjoy the rest of your afternoon. Thank you.